Today on the Cracking Backs podcast, we're joined by Dr. Robert Silverman, a renowned chiropractor, clinical nutritionist, and author of the Amazon #1 bestseller, Inside Out Health. With over 2 decades of experience, Dr. Silverman has been at the forefront of functional medicine, emphasizing the pivotal role of gut health and overall well-being. In this episode, we'll explore how the gut influences immunity, mental clarity, and chronic inflammation, and discuss some practical strategies to optimize your health from inside out. Welcome, Dr. Robert Silverman, to the Cracking Backs podcast. Man, I got to tell you, you've been at probably every program, presentation, and symposium, and you are the master of lecturing on health and nutrition. Welcome to the show.
Thanks for having me, gentlemen. I'm excited to be here, stoked to share some knowledge bombs with your community. Let's do it, man.
Right on.
Chiropractic is exciting.
Yeah, it sure is, man. So let me ask you this. For centuries, we've heard about all diseases begin in the gut. Let's fast forward to today, and we know roughly that 70% of our immune system is actually housed in the gut. So to kick things off, why is the gut become such a hot topic these days, and how crucial is it to our overall health and well-being?
The gut is the epicenter of your health. As you said, all disease begins in the gut, said 2,500 years ago by Hippocrates. Ooh. Now we like to say all disease begins in the leaky gut, year 2000, Alessio Fasano. So he's taking it to the next step. 70 to 80% of our immune cells are in our gut. My God. It's where our macro and micronutrients are absorbed. For chiropractors out there, write this down. There's a gut to joint axis. There's a gut to brain axis. There's a gut to disc axis. So I'm purporting to every chiropractor listening, when someone comes in with a musculoskeletal ail, they also have to analyze and test for gut permeability and gut health.
Wait a minute. Back up a second, because I got to ask you. That's the first time I've ever heard gut to disc health. And that is listen, not just for chiropractors, because we got a lot of regular folks out there listening, athletes and old folks like myself are listening and want to know, when we reach back and go off my aching back, could that really be related to the gut?
Without question, 52% of discal removals had a bacterial infection. Where did that bacterial translocation come from? It probably came from the gut. Well, anatomically, if you look, here's the spine and here's the gut. They're kind of close together. 2021, there was a study that spoke about the idea that chemical or bacterial infection could now be the leading cause or a main contributor to intervertebral disc damage. So with all that being said, and data indicating that, we now have to progress. And I know you're both progressive chiropractors. Tomorrow's going to be a better day for everybody who sees you than today is, because you're going to be that much better.
Yeah, right.
So within that, everybody's got to start looking at the gut. And for me, that's exciting because contrast leads to persuasion. I mean, gentlemen, right? Why are they going to come to you, me, Dr. Terry, etc.? Well, because we're going to have that little nuance, that little notch. And looking at the gut in a musculoskeletal light is really going to give us that built-in advantage over maybe physical therapists, maybe the orthopedists, etc.
So, let's go a little back into your history. Now, you didn't start out as the gut guy, but your career as a chiropractor, you also got it as a nutritionist and functional medicine guy. And now, you're a rock star in the world of gut health and nutrition. So what was that moment, that turning point in your life that you went, you know what, there's something to this?
I remember the dean of my school saying, and he and I had a lot of acrimony because it didn't agree with his philosophy. However, we had some really good moving conversations. And he said that, when you practice 5 years, you'll finally be able to form an opinion. Mm-hmm. But at 10 years, you'll want to give money back to the people you saw in your first 5 years, and on and on and on. And it was getting some decent musculoskeletal outcomes doing more traditional chiropractic. Then I started to add the idea of fixing the body from the inside out. And that was the name of my first book. Then at the idea of the inside out, in came the epicenter of your health called gut and gut health. And once I applied that to my chiropractic practice, which I like to think was unique at the time, but more and more people are adopting that theme, really saw clinical outcomes increase exponentially. And that's what we want. We want something that enables us to exponentially increase our clinical outcomes with our patients, because, chiropractors should, at the very least, specialize in musculoskeletal issues.
Yeah. So gut health, it's become this big buzzword these days, and there's a lot of confusion out there. So, I always kind of find it entertaining that someone thinks that they can, drop down a probiotic or eat some yogurt or magically fix all the problems. In your experience, Dr. Rob, what do folks get wrong about gut health, and what does it really take to improve it?
Outstanding question. Really setting the stage for me to hit the ball over the fence without any steroids, 450 feet with some arc. Love it. Oh, I'm sorry. Did I use a sports metaphor? Are we allowed to do that?
We can do
because who better than a chiropractor to work with a sports athlete, setting a stage for a repartee. Like I said, chiropractic is fun. You can't bring a New York guy to eat bagels and lox every Sunday morning and not expect a joke.
Oh, you better. I would be disappointed if you did.
I hope I can remember the question now. I've done a diatribe.
Right. Gut health, things that people get wrong.
Yeah, I think a lot of people get things wrong in gut health, in that it was interesting question probiotics. Probiotics are, to give life, and they're a great starting point. But the data really indicates the next evolution is adding a pre to a probiotic. Because if you don't add the pre to probiotic, that probiotic, which has a transient life in the gut, needs to eat. And what would it may do? Well, if your gut environment isn't healthy, it's not going to have nutrients in your gut, and it may turn to your gut epithelial lining and start to eat it. So protecting the probiotic with a prebiotic and allowing it to populate is probably one of the newer takeaways. So if you're looking at the longevity concept or longevity theme, which I believe chiropractors are tremendously well suited to talk about longevity, a longevity hack would unquestionably be a prebiotic. So from now on, everybody remember, Dr. Rob said, if you order a probiotic, add a prebiotic with the probiotic, or eat it.
You're on a roll, man. So
I'm ready.
What else do folks get wrong about gut health? It makes them think that they can just take of this and then they feel of that. Anything else in particular that's a pet peeve of yours?
One of the more low-hanging fruit themes is the idea of gluten. So 1 in 100 people have celiac disease, which is autoimmune. So, X, no gluten. Right. 4 out of 10 people are sensitive to gluten. So that leaves 6 out of 10 people that says, I can eat it. Wrong answer. You do not win double jeopardy. Gluten is bad for everybody. It's deleterious to one's overall gut health. And it is so because gluten means glue and it sticks to your intestinal tract. So that's one. Number two, the gluten in America, unfortunately, has been exposed to glyphosate, which the World Health Organization has called a cancer-causing product, a chemical, which is in Roundup. So organic gluten, again, not a really good choice. So I've come up with an acronym, and everybody should adhere to this acronym, GPS. No gluten, no ultra-processed food, and no added sugar. 52 to 57% of the calories consumed by adults in America are in the form of ultra-processed food. So if you had to take one thing out to be healthy, to avoid joint pain or decrease joint pain, have a declivity in joint pain, you would want to remove or decrease your consumption of ultra-processed food. And by the way, most things with gluten are ultra-processed foods.
Wow. GPS. All right.
GPS, no gluten, no ultra-processed food, no added sugar. Sugar is the devil.
Great acronym. It doesn't just help you find your way back home, but it also helps your digestive system. GPS. Yeah, I love it. Along with the same ideas, a buzzword that I keep hearing about more now than ever before is microbiome. Oh, how's your microbiome? And what's really going on inside of the gut with all these, good and bad bacteria?
Another great setup. Now, I don't play golf, but it sounds like you teed it up. I mean, I'd rather watch grass grow. Oh, okay. Um, the microbiome. The microbiome is sort of a delicate ecosystem in different parts of your body. The number one microbiome that we talk about is what we're talking about right now, the gut. The second most interesting, evolving conversational microbiome is the gum microbiome. And I will give you a salient point about it. Number one, those people who have gingivitis can have a bacteria called gingivalis. That gingivalis can make gingipans. If you have that, you have a 90% increased risk of Alzheimer's disease. And the third microbiome is the skin microbiome. So again, your microbiome is a neighborhood of organisms, both good and bad. It's kind of like the neighborhood that we all grew up in. If there's too many bad kids, it's a problem. If there's too many good kids, it's kind of boring. You need those middle class commensal bacteria and stuff to really rule the day because they level the playing field. Same idea with your gut, your gum, and your skin microbiome.
A lot of people ask, what keeps us going during these long recording sessions? And the truth? It's all about the coffee. Stark roast to be exact. Seriously, this stuff is the perfect fuel to get us through every episode. And it's bold, it's smooth, and it's exactly what we need, whether we're cracking jokes or diving deep with a guest. Stark roast keeps me sharp, keeps me focused. It's the fuel behind every great conversation that we have here. Whether it's early in the morning or late at night, Stark Roast is there to keep us energized and ready to roll. So if you're a coffee lover like us, or just need that little extra boost to get you through the day, we highly recommend Stark Roast. It's the good stuff. Thanks for Stark Roast for sponsoring this episode, and click on the link below in the description to buy some of your own. It's the real deal. Now let's get back into it. You need to be a comedian. You need to do stand-up. I could feel it.
I tried to stand up and everybody laid down, so we can figure something out for it. Maybe comedy for yoga or something like that.
There you go. Oh, I love it. Oh, that's good.
Hey, you talked about prebiotic for for regular biotics and all this stuff, and people get confused with these terms. Can you define what you mean by a prebiotic?
Sure. A prebiotic is food or fiber that feeds a probiotic. So it's an indigestible food, but only digestible by a probiotic, interestingly enough. The stars of the probiotic world are fermented foods: kimchi, sauerkraut, coleslaw, dill pickles. Yum, yum, yum. Spencer, when you visit me in New York, yeah, you got it. I know where to get the schmear with the dill pickle, half sour. Oh my God, you guys, I love it.
At the deli. You got to go to the deli.
Carnegie Deli, where
yeah.
Sally had her moment. Absolutely. But it was actually not Carnegie Deli, it was Katz's.
Katz, right.
So if you had somebody that didn't want to take a drink or like the quick pill, like Spencer was talking about, what diet is a great pre and then a post for your gut? What would you, besides the GPS?
I actually didn't hear the whole thing because, believe it or not, the
So
police just drove by in my New York street. So you said if I had to have a drink?
No, what's a good foods that are good prebiotic foods?
Kombucha, if they didn't add sugar, is great. Unfortunately, most of the kombuchas they have a sugar. So that would be my go-to. I'm a big proponent of a green tea. Just be careful the amount of cups you have because green tea is quite caffeinated. And some people have an aversion to a large number or a large amount of caffeine. So those would be the two that scream out to me to start the day.
Got it. You mentioned earlier leaky gut, and when your intestinal line becomes more permeable, we lead problems like chronic inflammation and inflammatory conditions. And conditions like diabetes, autoimmune. What's some things that might not automatically leak to the gut that, besides the disc, that people have health goods and can start to work with their gut to make it this leaky stop leaking?
Well, there's a litany of things that can make it leaky. The number one thing would be antibiotics. Now, I'm not anti-antibiotic. I hope that's not an oxymoron. I mean, I tell everybody if I have meningitis, you know what? Give me an antibiotic.
Yeah.
If I've got a staph infection, you want to chop a big piece of my thigh off, give me an antibiotic. When I had COVID and it was a viral infection and they said, I'll give you an antibiotic, the emergency brake was put on because it just didn't make sense. You have to evaluate it. So antibiotics have their place. That said, they will blow up their nuclear weapons, everything in your gut. So you're going to be on a 6 months post antibiotic protocol because 2 Z-Packs will damage your gut for about 6 months. So you've got to weigh that.
Wow.
That said, let's move on to something that I find even more egregious, which are PPIs, proton pump inhibitors. They can be taken or should be taken for 4 to 6 weeks. They're typically taken in my patient base, unfortunately, for months, years, and even decades. They will increase leaky gut dramatically and also damage what we like to refer to as the blood-brain barrier. Concussion, you guys are sports oriented. 6 out of 10 patients that have a concussion have something wrong with their gut, whether it be leaky or small intestinal bacteria overgrowth. Cesarean, the skin microbiome is vastly different than the vaginal flora. For me, one of the big takeaways would be food sensitivities. Good food, healthy food, is a potentiator for health information. Bad food is a potentiator for inflammation. I believe that food sensitivities are one of the biggest reasons for chronic hidden inflammation in our patient base today. You could also look at food additives, food emulsifiers, gluten, sugar, alcohol, dairy. I got an acronym with dairy, everybody, DNA. No dairy. They love me in Wisconsin when I say this. Ooh, cheese curds galore. No dairy, D. No nicotine, N. No artificial sweeteners, A. DNA.
Very good.
Spencer's feeling my pain going to Wisconsin. They go, I kind of like this guy. It's okay, he's got torticollis, but if he says no dairy one more time, I'm going to throw some raw milk at him. I mean, that's just like...
Some sour milk. Sour milk.
Oh,
sourdough, great question.
During we'll call it the pandemic, we started hearing everybody talk about brain fog, and that became like another hot topic. And yet, a lot of people don't realize that our gut is our second brain. Can you? How do you work with them when somebody comes in and talks to you about brain fog? What's your go-to about that?
Outstanding inquiry. I love it. So just remember, the gut to brain axis is the super highway to health. By the way, you said the brain is your second, your gut is your second brain. It actually has the largest nervous system in the body called the enteric nervous system. Another reason why chiropractors who are centrally nervous system oriented need to start evaluating the gut. There's this nerve called the vagus nerve, cranial nerve number 10, medulla oblongata down through the transverse colon, 80 to 90% afferent. Afferent meaning going from the gut to the brain. So therefore, the gut, which has that largest nervous system in the body, also communicates with the brain, part of the central nervous system. How could we not say that the gut is not a health bullseye? So to get to your question about brain fog's typically stimulated or affected by gut. You typically will get gas and bloating to start because there's no pain fibers in your gut. So the only symptom that system is damaged is gas and bloating. Hi, it's great to meet you at synagogue and church today. Do you get gas and bloating after you eat? I mean, how many people are going to be forthright with that? But brain fog they'll talk about, and brain fog is because there's a neural quelling of conduction between the gut and the brain, which refers to the idea of brain fog. There are no pain receptors in the brain. So again, the symptomology is brain fog, that neural impulse has been compromised and possibly the blood-brain barrier. By the way, just to pile on, as much as I talk about leaky gut, if you have a compromise in your blood-brain barrier, that's probably worse.
How could you get a compromise in the blood-brain barrier?
Well, you can damage your blood. It's an excellent follow-up. You can damage your blood-brain barrier from a multitude of things, but typically it's going to be from a gut issue. and or trauma or some autoimmune issue in your brain. And that autoimmune issues are typically neurodegenerative disease. So as an FYI, everybody, all these neurodegenerative diseases that we're talking about and arguing about, Alzheimer's, Parkinson's, ALS, MS, all have a gut origin. They're bidirectional, they're autoimmune, and most of them are because there's a dysfunction in the immune system, typically the innate immune system, and not necessarily anything wrong with the particular structure. I just had Dale Bredesen. He has a best-selling New York Times book talking about the ageless brain. And I mean, really, he moved my meter when we started to talk about that.
Oh, gosh. So people are going on, medications for anxiety and depression all the time. I mean, I'm hoping that we're going to, with this new approach to governing, that things take a little bit of a turn here. But before someone takes any of the anxiety or depression medications, what's an action step they can do first?
It's great that you say that, because there's something called psychobiotics. So interesting that you take a probiotic or take certain probiotics to positively affect the gut, which will signal and have a positive effect on the brain. But food, it's an interesting thing. There was an IRB study done with food sensitivities. And believe it or not, the second set of symptoms that abated when these foods that you were sensitive to were removed were gas and bloating and brain fog. Number one set: anxiety, depression, bipolar, the mental health stuff. So if you find the foods that are right for you, that are synergistic to allow a salubrious response, you're going to be on a health promoting pathway, which really goes back to that statement I made before, how important food sensitivity testing really is.
That's an important point, because now you can go online and you can get a food sensitivity test as a regular folk. What do you think about that, and how would you suggest them? Because I know there's listeners out there that are not doctors that would want to do a food sensitivity test yesterday. Any thoughts?
Yeah, so the things you want to look in a food sensitivity test, or I think the best test out there, would be one that has a dual pathway test. So I'll break this down as simplistically as I can. Let me get a little granular, if you will, in that there's really three parts to the immune system. The digestive tract is the outside part of your body, but we're really not testing that in the food sensitivity test. There's something called the innate and the adaptive immune system. The innate immune system is something that we're born with. It's innate, if you will. The adaptive or acquired immune system is something that we acquire over the duration of time. So in theory, with this acquisition, our immune system should be better as we age. Unfortunately, we're finding out in America that is not the case. So most food sensitivities are based on an antibody, which is part of the adaptive immune system, which is called IgG. IgG is the most abundant antibody. It's the smallest antibody. It's about 75% of all the antibodies. And it's so small that it passes the placenta and can actually get to the fetus. So we're looking for an antibody response. So IgG, believe it or not, has 4 different subtypes: 1, 2, 3, and 4. So you want somebody or a company to test for IgG 1 through 4. So obviously, if you have an antibody, you're responding adversely in raising some inflammation to a food. But the secret sauce to it all is also to test for the innate immune system. And that innate immune system has an old pathway, which is called the complement cascade, complementary inflammatory issues. I never knew. I don't remember. Guys, do you remember learning this in school, that when you produce too many antibodies, you produce inflammation?
No.
I read Robin's book. We read Robin's book. I asked 3 of my Harvard friends, and they look at me and they go, "Rob, are you taping me?" I'm like, "No, dude." They're like, I think I heard about somebody like a whisper, like Rome is a whisper kind of deal in Gladiator, but it wasn't a definitive thing. So the point is, when you produce too many antibodies, i.e. via IgG, you need to produce inflammation to kill the pathogen. and you can stimulate that through the complement cascade. You need to test for a molecular molecule called C3D, which is the most stable molecular molecule. So you're looking for a food sensitivity test that tests for a dual pathway. So you'll have higher accuracy in which foods are raising your inflammation. That's why most tests should be called a food inflammation test.
Oh, what a great idea. Great thought.
Mazel tov.
Wow. That's fantastic. Thanks. Thanks for that. So if a patient walks into your office and complains about, whatever various conditions that they have, other than low back pain or whatever, what's the first thing that you would do? I guess it would depend on what questions you ask, but is there a protocol that you follow that you would suggest other people be aware of?
Sure, I'd love to share a little look behind the curtain, if you will. My left hand is my chiropractic hand. My right hand is my functional nutrition, functional health, functional medicine plan. So chiropractically, we're going to look neurologically, orthopedically, functionally, we'll have them move, palpation. Nobody palpates better than a chiropractor. I mean, the first thing I tell all these young chiropractors, they say, what skills should I have? Well, guess what? We have the ability to touch, get a little better at it. Then you got to communicate because you're touching people. So you want to communicate appropriately while you touch them. So I take care of the chiropractic, but from the nutrition side, which I think you want me to emphasize, I take a 22 vial, I send them out for a 22 vial blood lab, which really is very much more lateral than what most medical doctors do and a lot more vertical. We're looking at all different systems. Most medical doctors, and I love my medical doctor friends, I'm in a medical building, do a pretty bad job because they only test for rudimentary numbers. They're not evolving. They're not really testing to allow no guessing. I like to test so I don't have to guess. And then I do a food sensitivity test and a leaky gut panel to show some blind spots that I may have had in some of the previous tests. So chiropractors, I'm a big believer. Obviously, if someone comes in with an ankle sprain or a lower back, acute lower back, you don't have the time for these tests. But if someone's coming in to be a patient, and they've got a week or two before they're coming in, these are the tests that I'm going to adhere to and really guide me to look inside the body. I can't tell you how many statuesque men and women I've had walk in and they've had calcium scores that have been horrific. So again, and then by the same token, I've had some guys that probably, they're a little loose in the middle and yet their blood labs and everything are great. So again, the old adage, don't judge a book by its cover. Look through it.
That's great. So switching gears a little bit, there's so much confusion with nutrition labels and just the whole cryptic, food labeling. And even if you do know what it is, there's things that are hidden that you're not really sure. And they may disguise it as a different name of an ingredient that is not good for you. But do you have any suggestions on reading food labels or choosing high quality supplements or knowing when a functional lab test is actually worth doing?
Yeah, reading a food label is critical. So I've got my 800 SAT Carpenter, and that's in the era where you got 1600 was a good score, 800 was one, you got an 800 combined. And he always makes the joke, I'm the 800 SAT guy. He said, these food label things, they're a little involved. So I'm only going to pick foods that have one ingredient or two that are from low number of ingredients and that are from nature, like organic broccoli, grass-fed beef. If they've got to list everything and I've got to decipher it, I'm not buying it. Makes it easy. So the takeaway there is low ingredients, low number of ingredients, single ingredients that are made from nature, whole foods. Yeah. And again, Jack LaLanne, who was a chiropractor, once said, if man makes it, I won't eat it. So again, watch those ultra processed foods. As far as your supplements, there is a black box there that we have to watch. We're hopeful that certain things will change in our favor, but you're looking for ingredients that are GRAS, not the stuff that you smoke, GRAS, generally recognized as safe. So you're looking for that. You're looking for third-party certified companies. My suggestion to everybody, before they buy, what amazes me, we as chiropractors, and this really kind of like I don't want to say it perturbs me, but it amazes me is that, yeah, I buy from this company or that company. Did you ever inquire? Huh? I'm like, did you ever inquire? I mean, did you ever inquire where they get the ingredients? Did they get an assay? Because now with the advent of this thing called the internet, people have access to all our supplements, unfortunately, or most of our supplements. So how can they differentiate it? Well, again, contrast leads to persuasion, as we talked about before. You want to differentiate it by understanding that they're using good quality ingredients, ones that are showable on an assay, and the like. So be careful, buyer beware.
Lab tests. Those are
My favorite lab test. You know what? You can always get a good functional medicine test with LabCorp and Quest. Full disclosure, my favorite food sensitivity test is KBMO Diagnostics. They do a great job. They have the Fit 176 test, and they use a gut barrier panel. There's some poop tests out there that are good. There's some hormone tests, the Dutch coming to mind. There's a brain span if you want to test your quality of your brain cognitivity. If you need to go past that, give me a call because we've got to talk. You may have missed something.
Love it.
very good, very good. No, thank you for sharing those because there's a lot of people now taking action on their own, and there's also the those that online that provide the not so credible tests, but they're cheap and they'll give you an answer or two. So thank you for sharing that.
My pleasure.
Yeah.
This is fun, guys.
Oh, you make it fun.
So which sport is it? Is it basketball, football? That's your favorite sport? Dr. Barron, what do you say?
You'd be surprised. None of them. I never watch any of these professional sports. I just love.
Falling.
Badminton.
You just got called on a carpet, bro.
Yeah. I just love the mechanics of or the biomechanics of sports and how to fix people that are high performing, just like Dr. Terry. As far as I think my longevity in pro sports is because I have no idea who I'm working on half the time, and they appreciate that. It's always doctor-patient relationship. But thanks for asking.
So do you have any sport you watch?
Me?
I'm a basketball guy. So right now it's basketball playoffs starting. I am in. That's right. We read New York City, point guard city.
Wow.
I love this team. I love that team. Knicks, all the way.
We need a bench. Sorry, I hope they're not listening.
We do.
To me.
We definitely do.
They got 5, and then they got a couple after that, but it doesn't go too deep.
Oh
yeah, no.
As long as it's not the Celtics.
I can't stand them right now.
Oh gosh.
Oh my goodness.
All right.
Do you watch any sports?
Me or Dr. Rob? Me? Spencer. No, I do not.
Interesting.
No, I don't. I don't. Unless a patient comes in, like even an obscure sport like women's rowing. I know nothing about that, but when I saw a lot of women rowers, I started wanting to look at biomechanics to understand why they were having intercostal sprains, like several of them. And it was fascinating to see what a good rower is like versus a ineffective rower. So
rowing's a great sport.
Yeah, it's pretty cool. It was. But anyway, back to Dr. Rob.
Back to the matter at hand.
Yeah. Last but not least, you wear a lot of hats, man. Clinician, researcher, educator, author. I think that's so fantastic, and that's how I know you as a stellar speaker. But
thank you.
Given all that broad perspective, new developments in gut health or nutrition science, what are you most excited about now? What's going on now? And how are you bringing those cutting edge insights from research into your day-to-day stuff?
The two things that I'm most excited about, it's without question the incisive conversation over the last 3 years would be the concept of longevity. And as I said before, and I'm happy we could come back to this, circle back, take another bite at that apple, is that I think chiropractors are best suited as longevity experts. I think that Sometimes we're so ingrained in what we do so well, that central nervous system, that we forget the progression and the offshoots of that. So, for instance, if I were to share some longevity hacks with everybody, both for chiropractors themselves and people who are non practitioners, number one, food. Let food be your medicine, let medicine be your food, to use another quote from your favorite guy, Hippocrates. Two, dramatically decrease your consumption of starch, sugar, and ultra processed foods. Three, exercise, incorporate resistance training. Muscle mass is the currency of longevity, or as Dr. Gabrielle Lyons says, muscle mass is the longevity organ. But it's more than muscle mass, everybody. Muscle mass is a great starting point. So let's say I'm 185 pounds and 12% body fat. I'm doing a good job. I come back next year and I'm same height, hopefully, 205 pounds, same muscle mass, but 24% body fat. So the entry level, the step number one to the stairway to health is muscle mass. Number two, higher step would be body composition. And the highest level would be a good VO2 max for cardiovascular understanding or performance, and then grip strength, hand grip strength, because Spencer and I may go to the gym and I may have some built-in advantages for a deadlift and he may have some built-in advantages for a bench press or whatever. So it's impossible to really determine strength, but if we have good grip strength, each one of us, we're ahead of the proverbial curve. Sleep, another great hack. It's where your body and brain detox. You know, your brain goes to 40% of its size when you go to sleep, getting rid of all the metabolic wastes. 1 hour improvement of sleep decreases dramatically the incidence of Alzheimer's and neurodegenerative disease. I suggest everybody, let me see your hands, guys. I'm not looking to see if you use your nails. Okay, I don't see any Oura rings, so I have my Oura ring on. I'm big on health detectables. There you go. Sorry, I missed that. I got my little webcam right over your hand. I'm really sorry. I covered you and I'm looking at Spencer.
That's okay.
The bliss, the bliss. The health detectables. So big on the Oura ring. I don't have any stock in Oura ring. I'll tell you the best thing that I ever did for a health detectable was a continuous glucose monitor. Wow. First of all, you know, you realize you're being watched, if you will. Number two, you find your uniqueness. If I said to you, gentlemen, what would raise your blood glucose level, at least what you thought would more, brown rice versus coconut, I would say most people would say brown rice. Well, that sounds great, but for me, it was coconut flakes, because my Eastern European background seems to use fat differently than many people do in carbohydrates. So therefore, I can eat brown rice without raising my blood sugar. But if you eat coconut, it does. It makes no sense, but it's that uniqueness to the individuality. Intermittent fasting, we didn't even cover that. I am robust on intermittent fasting, but the right kind of intermittent fasting, meaning 12 to 16 hours fast, 8 to 10 hour window of eating, and of course, eating healthy food. Now, what's most interesting is that men, we're push buttons. We can just press the button, intermittent fast, and get the benefit. Women from the ages of 12 to 50, menstruating years, they're 4 decades that they menstruate. If they intermittent fast up to 16 hours, it just doesn't work well for them, because if they're in a progesterone phase, their final 2 weeks of their cycle, which means PMS, guys, just nod your head and say you understand what I'm talking about. Right? You know, which is good, because if you don't understand what I'm talking about, you're going to get eviscerated. But on a serious note, it's an issue, and men and women do have to be treated differently because of the change in the hormones. Obviously, we're testosterone based, they're estrogen and progesterone based. So women have to approach intermittent fasting differently. So if you're doing that 14 to 16 hour window of fasting, the first 2 weeks are cool. The third week go from 16 to 14 if you're a female. And then the last week go from 14 to 12 and then cycle back. You'll get all the benefits of intermittent fasting, which are autophagy, the breakdown of old cells and using that debris and making new cells. That autophagy is critical because it also helps with something called immune rejuvenation, because you're breaking down your old immune cells and putting back new immune cells, and something called mitophagy, which is a breakdown of mitochondria, old cells making new cells, because mitochondrial dysfunction, and I know I'm laying an extra layer here of frosting, mitochondria dysfunction is one of the biggest conversations that you and I could have, because mitochondria is the reason, one, we have fatigue. Two, mitochondria is bacteria coming from the gut and its origin and communicates with the gut. And three, your number one mitochondrial organ is your brain. And obviously, mitochondrial dysfunction with brain dysfunction is neurodegenerative disease. Breath work is critical. We want to breathe through our nose and not our mouth. In addition to that, hot and cold. Oh, yeah. I love it. People say, do you sauna? Yes. Well, do you go in the Finnish sauna? No. Do you know you shouldn't say that? Why? And they're like, well, they're popular. And I'm like, well, I am not running for president, so I don't need to be popular. I need to be correct. So essentially, if you want to get a cardiorespiratory effect, positive cardiovascular effect, you want to do at least 2 to 3 times of a sauna, 19 minutes or less, and you want the sauna to be about 146 degrees. If you're sauning after you work out, 170 to 174. If you sauna in a closed sauna of 200 degrees or more, you are damaging your blood-brain barrier, like a Finnish sauna. So get the ones which are more like a tent, your head's out. You can even play with your phone because your hands can go through it now, and modulate between 146 and 174. You don't have to jump into an ice bath like Mark Wahlberg does. If you want to freeze your fortitude, God bless. It's simple that the temperature rate should be between 50 and 59 degrees. So you can go from hot to cold. I know I'm wrapping it up. I know I'm on a little bit of I'm in fuego right now. I got it. So what supplements are longevity based? Because I hear people ask me that all the time. So I'm going to save that for a separate question, because I want to go into more detail with that. And of course, if you want a real good longevity hack, make sure you have an intake gut barrier. Make sure you decrease your food sensitivities. And the device of longevity, low-level laser, not red light therapy that heats my sauna, non-thermal low-level laser, which is based on photochemical responses and not photothermal responses. Now it's time for my Java juice.
Dr. Rob, we've got a good amount of time. I would love for you to talk about the nutritional supplements that you were about to mention.
Sure. So I'll be happy to go over some of my leading edge nutrients for longevity. The probiotic of choice is Akkermansia. I'm sure you heard about it.
Yes.
Akkermansia is great for blood glucose regulation. It's outstanding for immune health, and it matches with a great prebiotic, called XOS, xylo-oligosaccharides. Creatine. Now, I am sure that both of you guys have worked out. I'm sure both of you guys remember when creatine became popular. Yeah. When I graduated Chiro School, I went to Bridgeport. Bridgeport had a rule. You could only graduate if you wrote a thesis. It was the first thesis-based chiropractic school. So I wrote my thesis on creatine. So I'm imbued with enthusiasm now that everybody talks about creatine. Creatine's great for ATP. Creatine's shown to be a great longevity hack. It's wonderful for cognition in the brain, even more positive with women than men. And post-concussion, creatine's a great choice because it helps with short and long-term amnesia. XOS, I told you about that previously. It was a great prebiotic. NAD, there's a storage center for NAD in every cell. By the way, we talk about longevity. How come we don't talk about omega-3 fatty acids and vitamin D3? Did you know there's a receptor site on every cell of your body for vitamin D3 and omega-3 fatty acids? Talking about omega-3 fatty acids, a family member of theirs is something called pro-resolving mediators. They are a conversion from an omega-3 fatty acid that doesn't happen very often or efficiently in people. Pro-resolving mediators allow for the resolution of inflammation. If I were to share with you that my mantra, my mission statement is to manage and modulate inflammation, because most Americans are pre-inflamed before they come into your office, his office, and my office, pro-resolving mediators are the switch. So I get asked a lot of questions. Turmeric, great. Boswellia, great. Ginger, great. They are rooms in the house that you can shut the lights of inflammation off. The lipid class switch for the whole house lights is pro-resolving mediators. In addition, probably the peptide of choice, which you can take in the oral form, is BPC 157. BPC 157 is a peptide that's referred to as a Wolverine supplement because, like Hugh Jackman, he gets shot and he heals right before your eyes. Has these amazing healing qualities. It speeds up tissue healing and recovery. It aids in blood vessels being laid down, angiogenesis. Helps in the regulation of blood pressure. It's great for gum disease. Great for musculoskeletal healing. Probably a precursor to allow you to grow muscle mass because as a peptide, it is a bunch of amino acids, about 15, and 60 make actually a protein. And it also reduces the risk of oxidative stress. And chiropractors, it provides joint and tendon health.
I'm going to ask you two questions. Where do you get your? I was going to actually ask you about peptides. Where you get your HB 157, and where you'd like to get your creatine from?
Sure. BPC 157 I get from a company called Healthgevity. So it's healthgev.com. And he knew I was coming on, so he teed it up for me. Dr. Rob is a code, and you get 15% off. How's that?
Love it. Love it.
He's a New Jersey guy. He's not a bagel and lox guy. He's more of a spaghetti and meatball guy, but it's okay.
We're all the same.
The
Jews, the Italians.
We're getting grass-fed beef with gluten-free pasta now. So
right.
hey,
love it.
Let's dig in.
Love it.
So healthgev.com, Dr. Rob.
Perfect.
So
15% off.
Let me ask you, this is a little controversial, but body protection compound or PPC 157 is unfortunately on the banned substance list. And the only way you can seem to get it is through these online companies, as long as it's for research on animals. So how do you know? I mean, I trust you, like you did your homework. How do you know what's good out there if you're going to order online?
I agree. Well, this guy's in business. It's an oral.
It's an oral.
It's the compounds are the problem.
Okay.
And, I think it's like creatine. Remember where creatine got banned for a while? Creatine was told it wasn't good. Yeah. The reason guys in the gym who are 300 pounds and 5'9" were damaging their joints was because of creatine and androstenedione and everything else. It couldn't have been any other supplement that they were taking.
Yeah.
It was that. And I think that BPC 157 is like the Shawshank Redemption. He's going to come out on the other side clean as a whistle.
Good. Yeah.
And the orals have been shown to be virtually as effective as the injectables.
Very good. Good to hear.
I'm
glad you mentioned that.
I love this conversation on longevity because, especially in Dr. Spencer's area, in my area, longevity has become, and my analogy is dent repair. You have these beautiful cars and on the body work, they look fantastic, but they don't even start up and get out of the driveway. And so many longevity clinics are fillers and injectables and neurotoxins, that they're Botox and all that. And that, to me, that's just, I don't care if you look like a China doll. If you can't get out of your chair, that's not longevity. So I'm so glad we're talking about from the inside out is true longevity.
Yeah, the definition of longevity is lifespan versus health span. And I like to look at something else as a third lane called vitality. Now, interestingly enough, the lifespan in America is starting to decrease. So the average American lives to 77.5 years. Unfortunately, they get something called a chink in their health span, a chronic disease, at an average of 66.1 years. So let's do the numbers. I actually have an accounting degree before chiropractic because everybody did something before they went into chiropractic. I was in accounting. So that said, the last 18% of your life in America, you're housed with a chronic disease. 86% of our Medicare dollars are spent on chronic disease, and 98% of our Medicaid dollars are spent on chronic disease. So yeah, we're longevity docs. We want to be, but unfortunately, we got to get them out of the chronic disease issue to enhance their longevity, which is their lifespan and health span, trying to raise it and parallel it. But vitality, just like you guys, Spencer especially, we travel all the time. I mean, it's tough. We got to go to the gym in a hotel. If we make it, they have 50-pound dumbbells, and I'm maxing at 55. So I'm pissed that they're not there. But more so than that, you want to be able to lift your luggage to put it in the overhead bin. Sometimes they make a connecting flight and sometimes it's tight. And yeah, I feel like I'm OJ in the airport. I'm running. You got to be able to run. You're pulling, you're holding and stuff like that. That's vitality. I want to come home at 7:00 on a Sunday night. I don't want to have to go take a nap. I want to say, hey, honey, I'm happy to be home, as opposed to, hey, honey, I'm tired. I need a nap. I'll see you in 12 hours. Right. So everybody wants to enjoy their life. They're not worried about necessarily how long they live. They're worried about how healthy they are while they live. That's another guise under the temple of longevity.
Very nice. Hey, Dr. Rob, you mentioned something earlier that I just want to address before we get into our even more fun section of our program. But you said something about grip strength. And I don't want anyone to underestimate the power of grip strength, literally and figuratively, is that especially in South Florida, grip strength has been directly related to your cardiovascular system and its effectiveness. But more importantly, how we talk about the elderly and falling, and in South Florida, for some reason, falling from a ladder is commonplace. You fracture a hip and you're definitely courting death shortly after. But being able to grip and be accurate and quick about it is everything. So I think that it's important to elaborate on something so simple that anyone can do at home. Is if you can hang on to a very heavy dumbbell for 90 seconds with both hands or something like that, then you are in a very good place versus if you can only do it for 60 seconds or even only 30 seconds. So it's something to look into, but I thought that was really important to bring up for our longevity purposes.
Piggybacking on that, you made a good point. Balance. As old to be balance. Awesome.
Yes.
Muscle mass enables you to have a better insight to balance, proprioception, balance, and the like.
So important. Thank you for mentioning that too. That's a big one. All right. We're going into our favorite part of our program. It's the rapid fire questions. We have 5 of them set up for you, and I would like to be quick answers, but we tend to get hung up in it. I have a funny feeling, based on your humor and creativity, that you're going to come back with, and wit, you're going to come back with some good stuff.
See what we can do.
Are you ready for question number 1?
I'm ready. I love rapid fire, New York style. Let's go.
Yeah, baby. Here we go. You once posted quite some time ago, life isn't a highlight reel. It's a messy, unpredictable, and full of setbacks. So what's a recent personal blooper reel, if you were to come up with one moment in your life that taught you something?
Oh, goodness gracious. I suffer from congenital torticollis, and I woke up one morning and it was worse than it was normally. And I had to deal with all the different questions on the idea of like, what's wrong with your neck? And then, of course, I've got to deal with the chiropractors who wanted to adjust the congenital problem.
Yeah.
But, on a grandiose scale, life is nothing but a setback. Anybody can win. It's when things take a step back and you can utilize that and learn from it and project a positive attitude. That's a real winner.
Nice. Question number 2. You've likened the body to the only place you could ever live and cautioned against neglecting it. What is one housekeeping health habit you absolutely never can skip in your daily routine, obviously, and one you admittedly should do more often?
You should never miss some form of movement or exercise every day. And I always should do a better job of flossing and spending time with our gum microbiome, because it's going to be the hidden treasure of health in the future.
Brilliant. Question number 3. You believe lasers are the most versatile healthcare tool we have today. If you had a magic laser to zap away one everyday pet peeve or annoyance in your life, doesn't have to be medical. What would you use it on first?
That wall that patients build up that they're right when they come in, and as opposed to let's come in and let's be an open book, an open plate, and let's make changes. You're coming in because you need to make a change.
Right.
Be willing to make the change. Don't say you're going to be the change. Make the change. Because every day, we talked about this before, every day is going to be a better day tomorrow. That's our goal, because we spend time today that we can't get back. Now, I could have been a smart aleck and just said some vocal cords on some people, but I want your ratings to be high.
I think they're going to be real high from this good talk. Question number 4. Mark Twain said, the 2 most important days are days you're born and the day you find out why. A quote that resonates with your journey. Beyond your role.
Mark Twain. Wow, I use that one all the time. You did your homework, guys.
Right.
The 2 most important days of your life are the day you're born. Everybody knows that. We lie about it sometimes, and your why. And I'll try and be as rapid fire as I can with the why. I believe that chiropractors in general, and then this is a moment of truth for all of us, should share our why. Because I think that many of us became chiropractors because somebody helped us. I don't think anybody decided to be a brain surgeon because they had brain surgery, with all due respect. So my why is real simple. I say I wear my why not on my sleeve, on my neck, because I have the torticollis. I mean, how many times do you see people walking around with congenital torticollis? So I went through a lot of interesting things growing up in New York City, in the Bronx, in a very, tough area. People didn't understand it. So I found refuge in a chiropractor and him helping me, and he changed my life around. And I literally got off the table and said, what you just did, I want to do for the rest of my life for anybody that stands in front of me. So your why becomes your mission statement, and your why becomes like what your dad said. You never go to work as long as you enjoy what you do. This is a blast. I mean, sure, I prepared. Sure, I've been preparing for years for podcasts and to talk to patients, but it's fun. If it was arduous, I would suck at it.
Oh, I love this guy. Question number 5, and the last one for today. You often emphasize that what you do for others lasts for immortality. Fast forward 50 years. What's the one thing you hope people will remember you for, besides your medical achievements, that reflect who Rob Silverman is at heart?
There's a little deja vu here, because yesterday I was working with my coach, and he said, write your eulogy. So, I wrote 2 of them. The first one was comical. Here lies Dr. Rob. He nodded his head often and well, and he cured his torticollis by going like this. But on a serious note, that I always told everybody I may not be the smartest guy, but you're never going to outwork me. You're not going to out-care me, and you're never going to out-empathy me. So if anything, when they say that, here's a guy who brought it every day, and he raised the bar because he tried hard.
Oh, what a great way to end. Dr. Rob, you are fantastic. Thank you so much for being on the show today.
Thanks for the opportunity, guys. Continue with what you're doing. I mean, podcast, the journey is there. I know it's not easy. You guys are busy. Your time is demanding. I really appreciate the opportunity and appreciate what you're doing, moving the field forward and sharing both with the populace and the chiropractors alike. Don't stop.
Thank you, buddy. We
Just
appreciate
remember, and I'm going to quote Maximus because I love the name, what we do in life echoes in eternity.
Love it. Thank you for listening to today's episode of the Cracking Backs podcast. We hope you enjoyed it. Make sure you follow us on Instagram at Cracking Backs Podcast. Catch new episodes every Monday. See you next time.